Some weeks ago, it was announced that the Department of Defence and the Minister was to close the Curragh Families Clinic that supplies primary care facilities to 480 families. The decision has caused shock in the community. It will cause enormous hardship for the 480 families, and it is, I contend, a serious breach of the Haddington Road Agreement.
Thank you. Minister.
I propose to take priority questions number 1 and 2 together. I have no plans to change the decision to discontinue the services provided at the Curragh Families Clinic. The Families Clinic currently provides free GP and pharmacy services to families of enlisted military personnel who are resident within the Curragh camp and surrounding areas. The service dates back to a time where the provision of medical service for all families of enlisted personnel was included in Defence Forces regulations. Following the introduction of free public hospital care for all citizens in the 1970s, the entitlement to medical services for military families was formally removed from regulations in 1987, and the family section of the Curragh Military Hospital closed at this time. However, the Curragh Families Clinic was retained because of the difficulty in obtaining doctor and pharmacy services in the Curragh area at the time. This is no longer the case. The service is an anomaly in that it is a benefit which is only available to a relatively small number of families resident within the Curragh camp and surrounding areas. Similar services are not provided to families of enlisted military personnel at any other location in the state. Further anomaly arises is that new personnel deployed to the Curragh in recent times do not receive the benefit of free family care. A number of reviews undertaken in the period since 1990 have recommended that the clinic be closed. The decision to discontinue the operation of the clinic has been made having regard to those reviews, equity considerations and the cost of the service. I'd like to emphasise that the families affected will have the same rights of access to public health services as other families of enlisted personnel. Also, existing services are being maintained until the 31st December 2013 to allow families to make arrangements to transfer to local GPs and apply for medical cards or GP visit cards if required. If any patient requires assistance in finding a new GP or applying for a medical or GP visit card, this can be provided by staff in the clinic during the transition period. As the Curragh Families Clinic is a facility that is neither provided to members of the Defence Forces nor encompassed by the CNA schemes for the Defence Forces, its closure is not an issue that comes within the scope of the Haddington Road Agreement. Insofar as the Deputy alleges it is, he is incorrect in that.
Deputy O'Farrell.
I think viewed as a desktop exercise, what the Minister says is probably correct. However, his response shows an ignorance of what is in fact the community dynamic and the community situation that exists on the Curragh, where primary care facilities such as they are have been available indeed since prior to the foundation of the state. The British Army, in fact, Minister, was able to provide services to the communities on the Curragh. Now, you're right to say there were previous reports suggesting that the facility should have been withdrawn. Your predecessors had the wisdom and knowledge of the circumstance to refuse to take that particular initiative. I'm saying to you now, Minister, if you proceed to do this, lacking in knowledge of the situation that exists on the Curragh, that you will in fact further impoverish the families who live on the Curragh and avail of the service. And you're going to force them out into a primary care sector in the greater Kildare area where the numbers of people involved cannot and will not be accommodated. The families involved in this particular initiative have surveyed the medical, the GP services available in the community, and they tell me, and I have no reason to disbelieve them, that no GP service has the capacity to take on board the 480 families or upwards of 1,000 people who will be discommoded as a result of this. Furthermore, there is a duty of care.
I'll let you back in.
Okay.
Minister.
I'm afraid the Deputy is mistaken in much that he's saying. I have full knowledge of the position in the Curragh. I have full knowledge of the situation of the families in the Curragh. This matter was given very careful consideration, and it's particularly anomalous that some families of military personnel based in the Curragh can avail of this service, and other families of military personnel based in the Curragh cannot avail of this service. And it's an additional anomaly that no such service is available to any other military personnel in any other part of the country. Now, before making these decisions, the issue of the capacity of GPs in the surrounding areas to take on and provide appropriate medical care to the families was carefully examined. With regard to the availability of GP services, there are currently 13 GPs working in 8 clinics in Newbridge and 5 GPs working in 2 clinics in Kildare town, listed on the HSE website. All the clinics were contacted to see what, if any, spare capacity they had to take on additional private and/or medical card patients. 5 clinics responded to the query. The responses received indicate there is ample GP capacity in Newbridge and Kildare town to cater for the clients of the Curragh Family Clinic.
Thank you.
And indeed, arrangements will be put in place when families transfer to GPs to ensure medical records are made available to the GPs who provide the service.
Minister.
I think it's important we put this in context. I'm advised by the military authorities that there are currently 289 enlisted personnel whose families are not entitled to attend the family's clinic in the Curragh. And I note what Deputy O'Friel had to say about my predecessors. Well, could I inform the Deputy with regard to my predecessors, no new families were accepted into the clinic since 2008. So a decision was made by a predecessor of the Deputy's party to stop families using the clinic. And the problem was that my predecessor didn't deal with each family equally, and has given rise to this particular to the particular issue. I should tell the deputies a full analysis of the service being provided at the Curragh Families Clinic was undertaken prior to the decision being taken to discontinue the service. The analysis concluded that the service provided by the Curragh Families Clinic is an anomaly in that it is a benefit which is only available to a relatively small number of families of enlisted personnel resident within the Curragh camp and the surrounding area.
Thank you, Minister.
In circumstances where no such service is available to any other enlisted personnel, and where it is not available to any personnel attached to Curragh camp since 2008, it ceases. There's no. It's entirely unfair to maintain a service that can properly be provided by local GPs.
I just let Deputy O'Friel in.
A couple of very salient points. Number one, yes, your predecessors made decisions for the orderly wind down of this particular service. A local survey by local people of the GP services, many of which I know, indicate that they cannot accommodate the upwards of 1,000 people that are involved in this particular area. And I would put it to you, Minister, that your decision is wrong. I would put it to you further that there is a duty of care resting with the GP who provides the service on the Curragh and with the Defence Forces, and that your plan to wind down this service within 3 months does not have proper regard to that duty of care, because a primary care service of this type cannot be wound down in 3 months. Neither is it a case that the medical cards that you speak of can be certainly provided to the people should they acquire them, nor can, in fact, the GP alternative services be secured within the time frame that you're talking about.
Deputy O'Friel acknowledges that since 2008, I think it would have been Deputy Willie O'Dea, when he was Minister for Defence, who made a decision that further families who locate in the Curragh cannot avail of these services. And as the Deputy so eloquently put it, he made a decision for the orderly winding down. Well, at what stage does an orderly winding down require that you make a decision to wind up a service? I think the stage has come. I think the stage has come when we have so many personnel, as detailed by me, together with their families based in the Curragh, who cannot avail of this service, and also when, having checked the position carefully, it is quite clear that there are local GPs who have the capacity to take on the necessary service for individual families. Now, I will say to the Deputy, if there are families who cannot be taken on by a local GP, if there's a family that has a difficulty, I have no difficulty at all in asking that the military or officials from my department provide them with the assistance necessary to identify an appropriate GP who has availability. But all of the information I'm given is that there is more than adequate availability by qualified GPs who are not only providing medical care to the local community, but if I could remind the Deputy, they're providing medical care to the families of all the other personnel located in the Curragh who are excluded from this particular scheme. And I assume the Deputy isn't impugning the medical care provided by the local GPs to the families who are presently excluded from availing of this scheme.
Thank you.